Every day, doctors, nurses, first responders, and hospital staff put their lives on the line to help those in need as they battle COVID-19 head on. Well, I sat down with the Centers for Children and Families Marketing Director, Melanie Size, and Executive Director and Therapist, Christy Edwards, with more than 20 years of experience to bring you this week's segment of Centers Solutions COVID Edition to discuss the challenges our frontline heroes are facing. Melanie and Christy, thank you so much for your dedication in helping our frontline heroes. Now, you've mentioned that some of our first responders and healthcare workers put their patients' needs in front of themselves, and this can sometimes lead to something called compassion fatigue.
It's a real thing. It's the point where you are taking care of so many people in such a, highly emotional and physical way that at some point you just burn out and you just cannot. It's like you can't even really put one foot in front of the other. So what we're wanting these frontline workers to do is to come and lay some of that on us and let us help them, kind of build them back up to where they're ready to go.
What are some of the challenges our frontline heroes are facing? And you mentioned this is not just for doctors and nurses and first responders, but you also include cafeteria workers and housekeepers in the hospitals.
They're hyper aware of the contagion that they're dealing with, and so nobody wants to feel like they're responsible for spreading it to anyone else. And our healthcare workers and our first responders absolutely have that emotion and experience every single day.
I think right now what we're hearing most of all is they don't have time to come because, once again, they're trying to take care of the people who are sick or who could possibly be sick. So for them being able to come in for themselves, that gets put on the back burner. It's all of us that are in the helping professions, we tend to do that, and especially in time of a crisis, that's what you prepare for. It's like when you prepare for war, and what we're telling everybody right now, we're trying to impress on them the importance of taking care of yourself while we're in it. Because sometimes when you get to the other side, it's so deeply entrenched, the fear and the anxiety, that it's hard to take care of it at that point. I mean, you can, but it's much easier if you can do it a little bit at a time as you're going along.
What are some of the signs to look out for that indicates you or a loved one needs help?
If there's anything that kind of takes you off your day-to-day game, like if you're not eating well, if you're not sleeping well, if you're making a lot of mistakes, if you're withdrawing and isolating, if you're not taking the time to take care of daily tasks, those are signs that your system is completely overwhelmed. And you've got to reach out and you've got to be able to talk to someone about those things, or your system goes into overwhelm and then into shutdown mode. It's how we're made to be able to continue operating or to shut down to recover and get ready to operate again.
You mentioned it's hard for first responders and medical workers to not bring the emotions from work home. Even your guest speaker in the podcast coming up, Dr. Summer Merritt, mentioned some tips as well to help.
Just checking the sources she needs to check, shutting down social media, shutting down television intake, and just spending some real quality time with her family. She had mentioned that she likes to do a little yard work outside and just things that allow her to connect with the world in different ways.
And everybody's talking about this everywhere you go. And if you go to work and you have to deal with it all day, and then you go home and it's on the news, or your spouse or your kids are going, well, I heard this or whatever, it's really hard to get a breath. When you walk in the door, you've got to take off your work hat and put on your on the mom hat, dad hat, or the at-home hat. So whatever you can use, whatever transition tool, it's like you immediately cook dinner, or you go out in the backyard and throw the ball around with them or whatever. It's that transition time that alerts them and alerts you that you are ready to shut down that part of your life.
What advice do you have for someone who's dealing with the loss of a patient?
You've got to grieve that. It's not one of the things you can put in your back pocket and say, I'm going to take it out when it's all over, because that's whenever you create that kind of trauma that builds on top of each other. So you almost have to give yourself some time to grieve. Cry on the way home. When you get home, journal. Phone a colleague that might have been working on the same patient with you or client with you and just say, this is heavy. Can I say a few things? Or, can you, if you're a person of faith, can you pray over me, or will you pray with me, or something like that? Acknowledging those that we're losing is important.
And we want you to know that you are never alone, and if you need help, you can always call the Emergency Crisis Hotline that's available 24/7. We have that number right there on your screen, 844 1-800-420-3964. And during the month of May, the Centers for Children and Families is offering the first visit free to anyone needing help. And through this pandemic, they are also offering any first responder or medical worker battling COVID-19 on the front lines their first 2 sessions free. And for more contact information and a link to the full Centers Solutions podcast to dive in further for a mini therapy session focusing on protecting our frontline heroes, head to our website, yourbasin.com. There you can also hear an extended interview with our experts and learn more about coping tips.